Good morning. Hey, you guys, welcome to Caroline's Table. We're going to have a little chat today, and the topic of today's show is going to be you, because I was thinking about the fact that as women, we're so often taking care of so many people in our lives, and we forget to take care of ourselves. And I know it sounds cliche and people say it all the time, but sometimes it requires actually an action item. So today we have a list, and it's going to be the me to-do list. So I want you guys, if you're watching the show on your phone, you might not be able to take notes on your phone if you're a digital person. So what I would like you to do is go get paper and pen, and I want you to take some notes, because we are going to, hi friends, see you all joining. We are going to create a to-do list, and it's going to be your to-do list. So me to-do list. And this is a time where I am going to demand that you stop thinking about everyone else in your life and all the things you need to do for the other people in your life, and you're going to make this list just for what you need, and just for what you need. And sometimes it's hard for us to do that. We will instantly pop up when it's time to take care of someone else. Like, oh, well, my grandson has soccer, so I'm going to go take him to his soccer game because my daughter needs help with that. Immediately you are there. You don't have time to exercise, or you don't have time to go get to that appointment that you've been putting off that you need to go make with your doctor. But you will be there if your daughter says, hey, my grandson needs a ride. Absolutely. So Donna loves her to-do list. I'm a Capricorn, so I'm a list girl. I tick things off. I'm super efficient. And this is where I had many doctor's appointments yesterday, and I kind of got a bunch of things done, and I'm really digging my new OBGYN because she really gives me a list of all the things that I should be checking. And it didn't happen. Nancy, I know it's you. I was thinking about Rocco. Like, you will drop at a hat and go take Rocco to soccer. I know you would. But, then where's the time to make sure that Nancy's getting her checkups and appointments? Who is checking on us, you guys? You have to check on yourself. So, we're going to talk about the list of medical things that we should be looking at. We're going to make our list. We're not going to get everything done in 1 month because we don't have time and you don't have the money to do all of it in a month. But at least if we have our list and we can divide that throughout the year and then set reminders that, like, oh, okay, this is the month that I have all of my breast exams. So let's start there. So have you had your appointment this year for your annual mammogram or ultrasound, or both? I want you to add it to your list. Okay, so we need a breast health exam. Okay, breast health. So for some of us, it is Self-Care Tuesday. Yes, Charmed Healer, that's what we're doing today. For your breast health exam, there are varying opinions about, should we have a mammogram? Should we not have a mammogram? You need to talk to your doctor about that. I'm not a doctor. I am not an expert. I have dense breasts, so I definitely need, in addition, an ultrasound. And my doctor is asking me this year to get a breast MRI. So I went and had I did have a mammogram and I did have an ultrasound. I have a strong family history, and yes, I did get a mammogram. So I was only getting high-level ultrasounds for a while, and my sister was only getting ultrasounds. And 6 months after an ultrasound, my sister was diagnosed with breast cancer. And believe me, a lot of her physicians were like, well, why didn't you have a mammogram? Um, I I can't tell you whether or not you should or should not have a mammogram. You have to talk to your doctor and do what is best for you. Hey, Bruce, if you are there, one of my lights just went out. So I decided to start having mammograms again. So mammogram, ultrasound. I have dense breasts, so definitely ultrasound if you have dense breasts. But they see different things. And then in addition, my doctor said, because of your family history, because you had your first child, I was 31 when I had Camellia, so they recommended also a breast MRI. So that was first thing on my list. Yes, advocate for ultrasound and breast MRI, and they found a spot for you. Okay, interesting. So I think that the diagnostic testing that we do, and some people, we avoid these tests because sometimes we're scared of what we might find. But I'm telling you, like, is it time? Yes, it takes time. Does it cost money? Yes, it costs money. Insurance doesn't cover all of it. But guess what takes way more time and way more money and completely takes over your life? A diagnosis of cancer. So this is where we can do as much as we can to prevent and as much as we can to advocate for ourselves so that we have early detection to, if something is going to happen, lessen the severity of it. Absolutely. So yes, check mammogram, ultrasound, MRI. Ask your doctor about those 3 things for your breast health and anything else and self-checks, you guys, so important, the self-checks. All right, number 2, are you taking care of your teeth? Teeth, big issue. If you have, something nagging in your teeth, there are so many times that proper gum health, proper dental care, if you aren't, it can become the root of so many other issues. So please make sure you are getting your regular dental checkups. Now, my dentist, it used to be every 6 months, right? Like for our whole lives, it was like you get your teeth cleaned every 6 months. Now they have me going every 4 months. So I go now every 4 months. You know what? It makes the cleaning a little easier because they don't have as much to do, and that is, I have a dental plan, so I know not everyone does. But yes, go and get your teeth checked and cleaned. So that's super important. Okay, I'm looking at all of your questions here. A lot of you are going every 4 months to the dentist. Good. Okay, how about colonoscopy? I'm 61 years old. My doctor said you definitely need to have a colonoscopy, and now they want me to go every other year. So I went last year. Colonoscopy. Okay. It's not that bad. You don't even have to drink that nasty liquid anymore. It's a pill. So it was super easy. I didn't have to stay home and, it's really not that bad. You take a pill, you have a nice poop, and you the next day go in and you have your colonoscopy done, and you wake up and hopefully they look at it and say everything's great. Again, early detection is so important, and that is a really important one. So add that to your list to speak with your doctor about. Why every other year? Are you guys going every year for a colonoscopy? She did not ask me to go again this year. Okay, what else are we looking at? I have to talk about your hormones. Hormones. So I had my checkup yesterday with my OBGYN, and she reiterated, she said, are you on vaginal estrogen? And I said, well, I am, but I don't really need it. And I said, you had me on it, but I don't really need it anymore because I've got this supplement and it's resolved this issue for me. And she said, oh no, you need to be on vaginal estrogen. She said, everyone needs to be on vaginal estrogen because, and she cited the study that I just read to you guys about UTIs, sepsis, and vaginal health. And so even if you don't feel dry or don't think there's an issue, unless your doctor has a reason for not putting you on it, maybe that's something different. That is where she absolutely believes that you have to be on vaginal estrogen based on this study they just did with almost 2 million women and showing how it reduces our risk of UTIs, sepsis, and death from UTIs and sepsis. So serious issue. She has me on it twice a week. It's the same day that I put on my bioidentical estrogen patch. I do that on Mondays and Thursdays, and she wants that vaginal estrogen. So again, check with your doctor about hormones and that including vaginal estrogen. In addition, she has me on micronized progesterone that comes from the compounding pharmacy, and she added testosterone for me. And I had tried testosterone before. I'm like, it wasn't a great fit for me. It made me gain a little weight, made me, a little angry. And she said, you know what, try it. It's a low dose. She said, it's good for energy. It's good for muscle building, which is super important at our age. So I am going to try it. She said, if you end up getting hair loss, and I was like, oh God, I don't want to think about, we get hair shedding and thinning at this age. So hopefully that's not going to be an issue, but I'm going to try it because of the health benefits. So, hey Heidi, how are you? Heidi, will you do me a favor? Will you text Bruce and tell him one of my lights is out? Because my phone is here on the stand and he's not hearing me. Thank you, sweetie. So Heidi was on a vaginal cream estrogen. They switched her to a pill because they said it was less messy, but it doesn't work as well. And I'm going to switch back. And you know what? I think the direct contact of the vaginal estrogen is really important for this study that they did on UTIs. So hormones. Broken record on this one, but we definitely need to have our hormones balanced. They decline as we age. This is how we can keep ourselves in top shape. So we need those hormones. Okay, let's talk about going to see a cardiologist. Are you guys, at what age do you start seeing a cardiologist? I had been to one because there was something going on when I was around 50 that I wanted to check. It turned out to be anxiety. Anxiety and heart issues can feel the same. Heart palpitations and pain in your chest and all those things. It's like you're having anxiety and it feels like you're having a heart issue. And, again, they can go hand in hand. So I always checked it because I didn't want to be one of those women. And it's so common with women, we don't go seek treatment as much. So if something happens, you go, oh, it's fine, it's fine. Oh, it's just a little pain in my chest. Oh, it's just a little numbness. And no, I had the paramedics show up at my house and they were so cute. But like the whole fire truck came, I'm like, no, you guys, I think it's fine. It just like, when they say like, if your chest is hurting and you're feeling heart palpitation, like it feels dumb for me not to call. So anyway, they did show up and they did check me. And it was at a time when I was dealing with a lot of anxiety. So that was a really important, I was irritated with myself because I kept thinking like, oh, I'm sure this is anxiety, but you have to check. You do have to check. So I went to have a full, oh, thank you, Bruce. He brought my light back. I had a full cardiology exam. They also did, he did quite a bit of testing. He did a coronary calcium, is it a CT scan? You know, big machine, you have to go in there and they don't let anybody else in. And that's how they check the plaque in your arteries. Do you actually have any calcium buildup or plaque in your arteries? So super important for them to, yes, your CT calcium score. So, and the artery ultrasound. Super important, guys, and your regular GP is not doing it. So is vaginal estrogen okay for someone taking hormone blockers post breast cancer? You need to talk to your doctor about that. Usually not, but try that supplement that I mentioned, because that is an important one. It's at my website, carolinesummers.com. It doesn't increase your estrogen, so it won't give you the same results as having estrogen back, but it does help to rebuild the tissue in the delicate area that will help to keep it healthier. So I hope that helps for you. A lot of you are on Membracin that you found on my website, carolinesummers.com. And when you click through to the site, make sure you use promo code Caroline, and you get a free month when you sign up for the 3-month subscription. Jill, it is called Membracin, and you can find it at my website, carolinesummers.com. And a lot of you have signed up and are doing really well with that. So, you know, and again, this is a supplement that helps rebuild the mucosal lining in your body. So, if you have vaginal dryness, it certainly helps with that. The delicate skin in the bladder can start to thin and deteriorate as well during perimenopause or menopause. So Membracin helps to rebuild those tissues and makes you feel a lot more comfortable, but also it is important for your health that those tissues remain intact. Otherwise, they are more prone to infection and rips and tears and deterioration. And so definitely, Christy got hers. She's taking her first dose tonight. And when you get it, guys, take 2 every single day. So the clinical studies that were done on the supplement, 2 every day for 3 months. And we do have really good clinical studies on this that showed how much it increased the comfort. It helped make sex more, less painful. And, you know, all of those issues that make us more comfortable, but also make us more healthy. Okay, so we got to a cardiologist. Your cardiologist is also going to look at your cholesterol levels, not just the overall number, but how much of the LDL you have compared to your HDL. There's a ratio. Really important to understand if you have a high amount of LDL, which is the bad one. There are additional tests that they do to look at your LDL to find out if it is actually something that is contributing to heart disease. They can look at those LDL, and if they're large, fluffy in structure, they're not as dangerous. If they're small and dense, they are more dangerous and can lead to plaque and heart disease. So there are additional tests that they do beyond, you know, when you go to the doctor and he or she listens with a stethoscope. They're important tests that we need to have done at this age. Heart disease is the #1 killer of women. So your doctor, you and your doctor will decide what the best course of action is. If your cholesterol is high, I happen to have a genetic high cholesterol issue that is not affected by diet or lifestyle. And that is something that, you know, I've never believed in statins. I didn't want to go on a statin. I was not going to need a statin. And when I went to this longevity cardiologist last year, he said, I want to put you on a low dose statin. The horror, what about the side effects? What about At the low dose, mine is at 5 milligrams. At the low dose, it does not cross the blood-brain barrier. So I'm not telling you to do it. I'm not telling you not to do it. I'm just telling you what a recent specialist in cardiology has told to me, so that you can go talk to your own doctor about it and see. I was on, there are all kinds of integrative things that you can do to help with cholesterol as well. And these are important issues that you talk about with your own doctor. In terms of, you're speaking at 60, what about younger women? I've been on hormone replacement since I was 40, maybe even 37. So these are things that, having a breast health exam, having a dental exam, knowing when it's time for you to have a colonoscopy, having your hormones checked, cardiology. I don't think any of these are outrageous to think that a 40-year-old would be looking at. So, but again, these are issues that you want to talk about with your doctor and see what's comfortable for you, Jess. Perimenopause is 13 years before menopause. So if menopause is average at 50, around 38, you might start feeling those fluctuations in your hormones. A little harder to track at that age. So got my cardiology exam. And I did have all of the calciums. I had the artery scan. I did the CT. It was comprehensive. And I will tell you, okay, hold on, Jolene. I'm going to get to you with the ovarian cancer. I will tell you the way that I feel when I walk out having done these tests and having received my results. It is as good a feeling as buying something really special. It is as good a feeling as going on an amazing vacation. The peace and the contentment that I get from going, I have been thoroughly checked and reviewed, and I feel so much better about knowing that I don't have that black cloud over me. So you can't do it all in 1 month because it's too expensive and none of us have the time. But if you can take this list and rotate it throughout the year, so like maybe this month is your breast health month, and maybe next month is when you go in for your yearly dental exam, and then you schedule your appointments throughout the year for your cleanings. And maybe October is colonoscopy month, and that's the year that you check every year and make sure to see if you need a colonoscopy. And maybe in July is when we finally find that doctor who's going to give us the life-saving hormones. And maybe April is your cardiology month. We also need to check our eyes. So this is something that, again, my insurance plan has dental and vision combined. It's an extra rider that I got. So you need to check not just with an optometrist, but you might need an ophthalmologist. I go see an optometrist. He's really great about scheduling appointments because what if it was bad news? How would you feel? I would feel like I'm happy that I have it sooner than later, because we can't avoid health issues, but if we know about them sooner, we can usually have a better chance at resolving the issue. So that's a big issue, guys. People are scared. They're scared to know. So instead, we hide and we don't go get these tests because it's anxiety producing. But let me tell you, when you get the testing done and you get that, it feels so good. Okay, so we need to get an annual eye exam to check our vision, I have so many friends who are like grabbing readers out of the drugstore. I'm like, well, don't you go get your eyes checked? No, I just get them at the drugstore. You guys get your eyes checked. You need to know how much your vision is fluctuating. And let me tell you, I don't like the fact I used to have razor sharp distance vision my whole life. I was 2015. So annoyed. I'm not anymore. And they're like, that's normal, that's normal, that's normal. I don't like it normal. So I wear contacts, and the contacts have really changed my life. This contact is just for reading. So I can read my phone, my computer without having to grab readers because I'm on my phone or computer all day. This eye now needs a contact for distance. So what happens is that you can train your body to just use this one for reading, this one for distance. So anyway, this is really a great, I love that I can look down and read something and look up and see far. So this has been an amazing change for me. I was noticing that I was losing a little more vision every year. So I did ask my doctor, I said, do you think I should see an ophthalmologist? Because your optometrist can only do so much with your vision health. And then you need to go to an ophthalmologist who has a more advanced degree, and they can really look at issues with eye health. But they do, every time I get an eye exam, they taking pictures of the eye, they take very detailed work, again, for prevention. So we need our eye exam. Okay, what am I forgetting? Breast health, dental, colonoscopy, hormones, cardiology, dermatologist. Interestingly, my cardiologist told me that I needed to have extra checks for skin cancer because of something that came up in my heart exam. So my father, now he was a lot older when he finally passed. He was 93. He actually had skin cancer, and my dad had gorgeous dark Italian skin. He was in the sun all the time. He was not a guy who used sunscreen. He was very active and outdoors quite a bit. You can even get skin cancer with dark olive skin. Skin cancer can affect everyone. But my cardiologist said it is a genetic issue for me. So dermatologists, this is one, like, I do go to the dermatologist because I go for vanity reasons. So when I go and I get Botox 3 times a year, used to be twice, it's now 3 times. And I went yesterday, and she just does a little right here to help with the furrowed brow, and a little here, which just gives me a little bit of a lift. You guys don't notice a difference than the last time I was here, right? And I have her now doing a skin check. Instead of every year, I have her do it twice a year. So it's not fun, but you take your clothes off and she checks every part of your body and she writes down all the places. And I had something on my back that had to be removed last year, and it was fine. But it's important to have that skin check. So please have your skin check. I'm 73. I've never had a colonoscopy. Yikes. It's time. It's time to do that. So I was kind of, again, the reason I'm sharing this with you guys is because I was seeing a great doctor for years and years and years. My doctor retired and someone else took over the practice. And the person who took over the practice is a good doctor, but it came at a time in my life where I was kind of thinking like, how come, I'd hear my friends say, oh, I'm doing the colonoscopy thing today, so I can't do blah, blah, blah. And I'm thinking, why haven't I done that? Why hasn't my doctor told me to do that? So I'm not telling any doctor how he or she should practice because they all have different methods and they all have a lot more training than I do. But when I went to see this new doctor and she gave me this to-do list, I was a little blown away that I hadn't done it before. So that's why I'm sharing it with you. She's a very expensive doctor. Not everyone has access to the same kind of medical care, but I want you to at least have a list of things to think about. And then I want you to divide it up throughout the year so that you can be looking at one thing each month that you can focus on. Bone density. So this was another test that I had done. I have it done at the same imaging center where I get my mammogram and ultrasound. The bone density test. So you guys, we got to keep those bones, because one of the biggest risks as we age is falling, and what can happen from brittle bones and osteoporosis is a very difficult thing to come back from. So I've always been a big advocate for bone health, and I hope you're taking a decent supplement with vitamin D and K.